Good afternoon. I am Dr. Kumar, endocrinologist at Magna Clinics, Himayat Nagar, Hyderabad. I will be discussing about some of the endocrine disorders, what you will be facing in the day to day, and how to approach and how to treat and how to investigate certain things. Endocrinologists are the specialists who deal with the hormones of the body, and they are generally the common ones. What we see are diabetes of all types, be it type 1, type 2, which comes in children or adults. And second thing, gestational diabetes is a diabetes which comes during pregnancy. Another big chunk of diseases what we see are the thyroid disorders. Thyroid is a gland which is there in the neck, and any excess production of thyroid hormone or deficient production, either hyperthyroidism or hypothyroidism. Other disorders which we generally see are regarding the growth problem or unwanted hair problem or any recurrent kidney stone problem. Some of these conditions come under the hormonal disorders. So when we look at the hormones, commonly the glands which produce the hormones are pituitary gland, which is there in the brain, thyroid, which is there in front of the neck, and you have some of the glands in the abdomen, which are the pancreas, and the gonads also. The gonads are ovaries in females and testes in males. So any of these also concerning the gonadal and gonad development and some of the disorders of it also see in the pediatric age group by the endocrinologists. So regarding the hormones and hormone balance, some of the tests or the symptoms what patients may come to us are, if somebody has got poorly controlled glucose, they come with maybe more of polyuria or more thirst or weight loss or changes in the weight, or whether they are having any unusual fatigue, or somebody has more of a hair loss or unwanted hair growth. Some of those things may be there due to a hormone imbalance. So whenever we suspect a hormone imbalance based on the patient's condition, we do some blood tests to find out what are the conditions. The blood tests in some patients may do a fasting value, some patients may do a randomly also, and in some of the hormones we do timing, especially in the ladies where we have a depending on the menstrual cycle we do. So the diagnostic tests what we do are generally blood samples only, and sometimes we do check about the urine samples. So the blood samples in some patients may be collected fasting, may be collected after the tablets or before that, and some of the hormone tests we do as per the menstrual cycle of the females, where some of the hormones you require a particular time during the menses about collecting the samples. Normally all hormone disorders are evaluated by only blood samples, and the sample will give you a clue as to what is the level of the underlying disease. Confirmation is always by the blood test. In some conditions, the symptoms may not be matching to the hormone level, so that those are the times we may have to repeat the sample and then for a confirmation, because the patient's symptoms and profile has to match with the blood test accordingly. After looking at the complaints and the symptoms about the diagnosis, then the treatment is mostly based on some tablets. Especially diabetes, you have different types of tablets available. In some who are not well controlled, we use insulin also, either once or twice or multiple times depending on what is the condition. Treatment is not very expensive in most of the endocrine conditions. Only thing is the treatment may have to be for a long term. In some conditions, may be short term in some conditions. It is important to identify the underlying cause, to identify how long the treatment is required in a given patient. Especially if suppose somebody has got a endocrine hypertension, somebody has diagnosed with a blood pressure in a early age, and if we are able to identify the cause, then we can actually correct the cause and then stop the treatment early. The same goes with the thyroid also. If you are able to identify why the patient has developed a thyroid disorder, you treat properly, then the patient may be able to stop the thyroid medication subsequently. So the treatment is dependent on the underlying cause, and the duration also will be accordingly. The follow-up is important. That is why in some patients we ask for a 15-day or a 1-month follow-up. In some patients we ask for a 2-month or 3-month follow-up. once the patient is stable or depending on the underlying condition. So, the follow up may be, frequency may be varies from 15 days to even 3 to 6 months once in a while. So, that will tell the patient as to when they have to actually come up. And the most of the endocrine disorders actually are dependent on the lifestyle. So, lifestyle consists of lot of things. Number one is the diet. Diet consists of what macronutrients and micronutrients, and what is the pattern of exercise, what is the pattern of sleep, what sort of exercise, what sort of stress you are doing, you are undergoing. All those things are actually determine your endocrine disorders as well as the therapy. Now, if you keep your lifestyle well, which includes, as I said, regular exercise, having a nutritious diet, all those things, most of the hormonal disorders will have a proper control. Having a proper sleep schedule, eating schedule and monitoring schedule will help. These are all part and parcel of the lifestyle. So, most of the diabetes, thyroid are lifestyle disorders. So, it is important to correct the lifestyle before looking for a therapies, before looking for drugs as an option. So, it is important to control that also. After all this, maybe if you are determined or if you are having a permanent disease, there are some support groups also as well, especially mostly applicable for diabetes or some other rare endocrine disorders, where you are actually understanding and interacting with close other patients who have got the same disease. So, you will be able to get some of the doubts clarified, maybe see how the journey their life, and it is important to understand, you will get more confidence from them about how to handle these diseases. Most of the endocrine disorders are not life threatening, but they only have trouble in some of the organs and long term implications. So, important to have a regular management and then have a regular follow up with the concerned endocrinologist, who will advise you to take a correct precautions as well as management. Symptoms generally of thyroid disorders are changes in the weight, hair loss or weight gain, skin dryness. For ladies, periods irregularity, and for children there may be differences in growth or poor scholastic performance. For diabetes, usually we have more of a weight loss, more thirst and any infection which is not getting healed, or unusual fatigue in the body. Some of the other endocrine disorders like pituitary, they may have hypertension, that is blood pressure being diagnosed at an early age, or some of the kidney stones being formed, or somebody is having recurrent fractures or severe acidity. Some of these can be a start point of the endocrine disorders complications. Only lifestyle based disorders, if suppose like say iodine is an essential component of a salt and essential component for thyroid hormone. So, lot of people use rock salt which is not having iodine actually. So, that could be a cause for thyroid dysfunction. So, if you use proper salt, iodized salt, you can actually cure the iodide deficiency hypothyroidism. So, it is important to have a good lifestyle. Somebody has gained about 80 kgs weight and he has developed diabetes. If he follows good lifestyle and loses 10-15 kgs, his diabetes will be reversed. So, having a good lifestyle is important to reverse some of the conditions definitely. Endocrine disorders are affecting in all age groups. Even from the newborn, there can be a thyroid disorder as well as a diabetes even in the newborns. In the middle age childhood, usually thyroid and diabetes are the commonest ones. Elderly age group, there may be hormone deficiency, especially in ladies after menopause, and there may be some conditions which cause weakness of bones. Elderly age group, the hypogonadism, there it is there in the elderly also. So, across the spectrum of life, you can have endocrine disorders, but the type of disorders keep varying in different individuals. Functional defect usually is there on internal organ functioning does affect, because if your hormones are not in a proper functioning, you may develop dyslipidemia, high cholesterol, you may develop liver dysfunction, you may develop kidney dysfunction. Some of these things do affect when your hormones are not in proper level and when your parameters are not under well control. So, they do have an effect, but they are slowly growing. Your bones may become weak, your bones may become brittle, your kidney functioning may get altered. So, some of these things do affect.